Hi, this is the treatment guide for ultraformer MPT. I'm Bonchol Gu, Chief Medical Officer of the Grasses, Korea. Ultraformer MPT is using microburst technology in newly developed one to give you a choice for the MP mode using the linear overlapped like coagulation columns. Also, you can use the conventional dot mode, make a fractional time of the proximal pattern of coagulation columns to make directional tissue changes. To compare the MP mode and the dot mode, you can see overlapping of the dot makes a line. So it's more than tens of the times the number of the dots can make a line or even circular shape of the lines. MP mode, a total of 4 and 17 TCP of the dots can make the elongated linear line in almost 40% of the time. Ultraformer MPT is providing 3 handpieces and 10 different cartridges. All of the cartridges can make MP mode and the dot mode. For body contouring, Ultraformer MPT provides 6.0 to 13 mm in depth, both MP and dot modes. So we can have more options for the cartridge selection. For example, for the superficial layers of the tightening, we will give you the option for the linear type of the MP mode to keep the booster action for the more different kind of tightening for the large area and the continuous kind of depth tightening. And also you can use whether the deeper layers with a linear crisscross or lattice pattern of the treatment for the more the facial contouring oriented treatment, and at the same time the conventional tightening procedure for the deeper smash area. The treatment design is closely related with the superficial important structures in anatomic location of the nerves. So if you're looking at the distribution of the facial nerve branches, usually the smash targeting treatment along the jaw lines, you need to check up the marginal mandibular branches, the superficial location. And also, if you are treating the upper areas, sometimes you can check the buccal branches and zygomatic branches. So the anatomic landmark is something the physicians and the operators should be aware of very well to avoid complications and also for the effective and comfortable treatment. When we are treating lower the facial regions, the surgical landmark can be given at the mandibular lines. You can see the step-by-step treatment along the smash line, which is maintaining the facial structures from drooling and the aging processes. Usually this one is using the dot mode as a conventional mode in a much more faster way than the previous ultraformer versions. Along the mandibular lines, if you are treating the sharp mandibular angles, maybe you can just keep the parallel horizontal shots. Or if your patient is a very round and continuous line of the curvatures, maybe you can just keep the opposite kind of directions. But it is the optional choices, because in the dot mode, you can just given with this the kind of the fractionated pattern eventually. So if your patient has the mandibular angle with a sharp mandibular angles, maybe you can just keep both of them. You can see that the lines along the nasolabial fold and marionette lines. So the lengths in between the lines, maybe you can choose, because the 3 centimeter of the lines you can just given with this the kind of lengths you can design how many of the lines can be given the in between the nasolabial fold and malleolate lines. You can see the kind of a parallel motion just along the two lines. You can just give the proper approach for them. Now we are moving into the different kind of depths for 3 millimeter depths, because the smash line is covering the from the temple to the mandibular angle to the neck. But if you are approaching to the inner side with the zygomatic arch, the lines, you can see that the 3 millimeter depths is giving the rejuvenation treatment for the lower dermis with the reticular dermis. And you can see that if you too deeply go for the pockets or the fat pad in the mid cheeks, you can give the unwanted fat remover or the fat decrease effectiveness. Sometimes if you are targeting the fat decrease, it's quite okay to make a more prominent zygomatic arch shape. Is quite okay, and it is, we expect that the kind of effectiveness can be given with MP mode much more effectively, but it is on the way for the protocol development. So if you are treating this area with the 3 millimeter depth, you can give the tightness, you can give the rejuvenation effect for the low reticular dermis. So it is a layer by layer approach. You can give these the 3 millimeter shots for these smash areas with the smash lifting is also good, especially for the elderly persons. Now we are preparing the periorbital and the forehead treatment with a 2 millimeter depth. Usually the not responsible for the specific kind of aging groups, but usually the 1.5 to 2 millimeter depth is comparable and the safer treatment for the perioral areas and the forehead. The surgical or the anatomical landmark is the orbital limb, so you can just touch the bony spaces, making the circular the spaces. So the direction of the handpiece should be given outside of the orbital rim or outward from the orbital rim, not inside orbit or not towards the orbit. So you can see that this kind of approaches can be given with a dot mode if the skin is so-drilled, or especially if it is the already wrinkled, you can give them. Or if the patient is not so-drilled one, but if the patient is suffering from complaining the starting of the looseness or the complaining of the lack of the tightening, you can see that the kind of the approaches for the MP mode for the periorbital area with a superficial layer, it can be given with this also with the boosted handpiece, the much more larger, faster lesions treatment at the continuous kind of a lesion approaches. You can see the tiling or the painting regional approaches ending at the orbital rim. And also another the good anatomical landmark approaching the forehead is the prefrontal arches. Anatomical landmark to approach the frontal forehead is frontal arch, prefrontal arch. So the kind of bony, the prominence, you can just give the starting lines, go forward to the scalp lines, like a lifting up of the hand pieces, making stacking the past two ways. And also if you are treating the smaller areas, which can be overlapped with the previous lesion treatment, you can go for these opposite regions. And there is another bony prominence if you are elongated pupil lines to the forehead. Usually that is the visible width of the face from the frontal lines. So if you are making the kind of prominences treatment, maybe you can just divide the temporal and the frontal kind of regions from that bony prominence at the lateral side of the forehead. After the treatment, when immediate reaction from the swelling and from the immediate tightening effect, this is temporary effect, but it is very good to show their faces to the patient to see this kind of reaction can be happening. Now this is another way of the treatment for the superficial texture improvement using MPT and the Deep Synergy Booster. Deep Synergy Booster is the specially designed the materials can replace any kind of the sonogears or the ultrasound gears. So application can be given with the MPT booster handpiece without using the conventional gel. And this Deep Synergy Booster contains the effective molecules specially designed for special purposes. For example, the granular components is giving the effectiveness for the brightening, and also the specialized the formula is giving the hydration effect. So when you're treating the smooth area with a deeper penetrating handpiece, and also you can give the superficial layer tightening and the boosting effect for this the combination option treatment. It is really given with the circular motions because the circular motion of the MP treatment is using the stacking of the heat temperature, the increasement for mostly for the superficial layer of the skin with the superficial papillary dermis. So this one is giving the 3-in-1 kind of treatment, the hydration and the texture improvement, and also with the tightening and the rejuvenation for the superficial dermis. So this one is quite good option for the completing all kind of a treatment for the multi-layer treatment approaches can be provided with Ultraformer MPT with the new features. And you don't need to remove this Deep Synergy the booster because it is designed for the hydration and the moisturization effect as well. So you can just leave them. The granules can be degraded gradually, and it is not remaining any kind of particles after the application. The patient feels a little bit warms and a very comfortable way of the treatment. And after the treatment, the patient can see that the texture improvement is complete with their superficial layers. So finally, to summarize the facial treatment with the Ultraformer MPT, the normal and ambient mode with both new technologies, you can see that the more effective and comfortable lifting treatment, especially expecting the facial contouring effectiveness, and also for the superficial layer rejuvenation. And the normal mode is for the tightening. We are expecting the ambient mode facial contouring and other new protocols to be developed. And with a newly added booster handpiece, we can provide the final touch of the treatment with the moisturization and the other kind of special purposes using specific deep skin booster, and also giving the good, better brightening and glittering textures as a completion of the whole layer by layer approaches. And for the booster handpiece, you don't need to, the applicators or the operators doesn't need to wash out the gels as a completion of the whole skincare. From now on, we'll talk about the body treatment using ultraformer MPT. We can provide a lot of the specialized body parts using the ultraformer MPT treatment. For example, you can see that there are a lot of different kinds of body parts, also with indications like cellulite and the striae. For the body parts of the body treatment, we have 3 cartridge selections. Focal length from the 6.5 millimeters to the 13 millimeters. You can choose the one of 3 body cartridges, and all 3 cartridges provide MP mode and DOP mode. For the deeper body part with the controlling, the decreasing the bulk of the fat, you can use the high energy of the MP mode to analyze this portion to remove or reduce some of the bulk body fat, and also you can give the dot part for the little bit superficial and also with the high energy to tighten the skin and giving the rejuvenation effect for the fibrous tissues. When we are treating the body parts, there is different kind of checking point for the anatomic structures. Both nerves and bones can be obstacle for the continuous treatment and also with the discomfort for the patient and also for the physicians to operate them. For example, for the antibody tubercles surrounding the joint like elbows and the knees, so you can just avoid both of them for the bony surfaces are located too superficially. For example, for the armpit, for the the antecubital fossa, you can see that the 10 centimeter from the elbow is quite comfortable landmark for the treatment. And also for the umbilicus and the floating the ribs and the iliac spines can be avoided for the body parts. For the pain, of course, and for the unwanted damage for the superficial structures, and the bouncing kind of a feeling from the bony surface is quite uncomfortable. So the operator should be aware of these kind of lesions to be avoided. Now we are starting to treat the lower abdomens. You can see that firstly we need to check the bony surfaces as a landmark. The targeting, the sideline, you can see that the fencer is the focus on the kind of the crossing area with the iliac spines. If you're going up to the upper abdomen, you can see that the end point of the bony tubercles from the floating ribs. And you can see this region can be divided into 4 portions, 2 portions for each the lower abdomen and the flank. And first shot should be given from just the side of that landmark to be avoided. I'm starting from the lines just below the umbilicus, not touching the umbilicus, and the treatment direction from that landmark for the toward the distant part. So you don't need to give the attention when it is approaching to the anatomic landmark should be avoided. And first we ask the patient everything is okay, and you can just give the proper shots for them. Because this one is a quite bouncy kind of area, you can see that the complete attachment to the skin, if it is achieved or not. So I recommend to push and move kind of motion is very comfortable and easy to treat. You can see that this kind of push, shoot, and move, push, shoot, and move, push, shoot, and move. This rhythmical action is quite comfortable for both patients and both patients. And we are using the MP mode first with the 9 millimeter and the 6 millimeters because when we are doing the pinch test, the 12 millimeter we recommend with the 6 millimeter in treatment. And for the pinch test, around the 18 millimeters and lower than this 26 millimeters, we recommend an MF9 at the 9 millimeter handpiece. And for the more than 26 millimeters in the pinch test, we are recommending the MF13, the 13 millimeter tips with the handpieces. So with the MP mode, with the lattice, the approaches, we can see that the decrease of the fat volume. Firstly, we can expect, and for the dot mode, you can just give the tightening effect for the fibrous fat columns, or adipose fibrous columns for that. For the lateral flank, as known as the popular lesions to be treated, the lobe handle, you can see that the MP mode can be given with a very, very faster ways. Usually this one has the no bone area and only fat, the pocket or the fat volume. So you can just give the MP mode a much more larger areas with the faster ways without any kind of the hesitation. So this one is also given three ways: push, shoot, and move. So you can achieve the treatment much faster than the other ways. If there are different kind of approaches, like already if there is some sackness and this kind of skin sackness is relatively superficially located, maybe you can just add that treatment. But this is quite bouncy, and this pocket is so deeper. So the patient demand is to decrease the tap volume or the contour faster way. So in this treatment, we are recommending the MP mode is much more comparable way and effective way to decrease the volume and the contouring at the same time. Also, you can give them one, and you can see that sometimes it can be overlapped, and sometimes it can be treated with the overlapping motions. But usually, if you are treating for the first time, maybe you can just give the not overlapping kind of a treatment first, and then if you are treating the focused lesions, maybe you can just keep the overlapping. But in this overlapping, the parallel overlapping is not recommended usually, and the opposite direction with the lattice or the crisscross pattern of the overlapping is usually recommended. And if the patient is lying down in supine position with the belly down, the back down, sometimes it is very hard to locate the handpiece vertically opposite 90-degree direction from the skin, because this handpiece should be attached in a vertically in opposite way from the ground, because the gravity, the fluid covering the transducer should be covering the transducer always. So if you are pinching up or lifting up from the down, the roll area, maybe you can just get the direction to make opposite contact from the skin perfectly. So using your non-dominant hand or the opposite hand to lift it up, and the combination with the both hands technique is quite useful, not making the changes for the patient position and a faster treatment. Thus, the central portion of the over treatment can be done with these 2 or 3 lines, the treatment, and this one is given with the MP mode and faster to decrease the fat volume and inside. And we'll give the normal the dot mode because the patient is a little bit elderly and a little bit the thin and the drooling looseness of the skin for the surfaces. So in this case is using the 6mm and the 4.5mm, using both of them MP and the normal dot mode, will give the patient with a much more better sharply the shaped contour for the frontal, the side lines. Usually the protruded or the convex kind of body parts like a knee, elbow, and other the jowls and mandibular angles. When the patient or the people is getting old, the drooling in between, the surrounding the kind of protruded lesions, sometimes it is attracting the other people's view. So usually those kind of lesions sometimes we need it to be tightened to make a better shape. Now we are giving the dot mode treatment with a push, shoot, and move combination. And we are holding the patella with the opposite hand to give the constant treatment, because if you are treating some kind of direction to the patella, sometimes you can touch the patella, and it is very uncomfortable because of the bouncing, the pain from the deeper side.